Honestly, if you told me that you hated your hearing aid provider, I wouldn't blame you. Most Americans are getting happier with their hearing aids. In fact, the most recent market track data from 2022 shows a 25% increase in hearing aid satisfaction rates compared to 1989. If this trend continues, hearing aid adoption rates in the United States will continue to increase, and they have already increased 15% in that same period of time, making American hearing aid use the most that it's ever been before in history. However, even though patient hearing aid satisfaction continues to rise, we are not seeing the same trend when it comes to patient satisfaction in their hearing care professional. Over the course of the past 8 years, hearing aid user satisfaction rates in their hearing care professionals has dropped from 95% to 91%. And non-hearing aid user satisfaction rates in their hearing care professionals has dropped from 87% down to 73%. These numbers are extremely disappointing, and they underscore a significant problem that we are starting to see in the hearing aid industry. So what could possibly be responsible for Americans becoming less satisfied with their hearing care professionals? Well, having seen several changes in the hearing care profession over the course of the past decade, I believe that there are 5 reasons why hearing aid users are starting to hate their hearing care professionals and possibly making even you hate yours. The first reason is a shortage in hearing care professionals despite an increased demand in their services. In a 2013 study, Drs. Ian Windmill and Barry Freeman warned of an impending shortage of audiologists over the course of the next 30 years because not enough audiologists were entering the workforce to replace those leaving the workforce. So why would a shortage of audiologists significantly reduce patient satisfaction rates? Well, if you have a lot of people who need the services of an audiologist, but you don't have enough audiologists to actually provide those services, the only way that you can satisfy demand is to reduce the amount of time that you spend with each patient. To provide a high-level hearing aid treatment and high-quality patient experience, it requires time, and the lack of time is a common theme that you're going to notice in the rest of this video. It is very rare for someone to have a high level of success with hearing treatment if their hearing care professional does not spend enough time with them when testing their hearing, providing them with the results, fitting them with their hearing aids throughout a fitting sequence, as well as providing them with long-term aftercare. One of the possible reasons for the shortage in audiologists, which is leading to a reduction in time spent with each patient, is the cost of education to obtain a doctoral degree. And by the time you graduate, the amount of money that you earn just isn't worth it. Despite popular belief, audiologists are not raking in the dough. In fact, the median income for an audiologist in the United States is $79,000, and that's typically not what you make right when you graduate. And this is after 8 years of post-secondary education, which could put you $100,000 or more into debt. Not to mention, at some point in most audiologists' education, they realize that if they're going to want to be able to make enough money to pay off their student debt, they're going to have to dispense hearing aids, which means that to some degree they're going to have to learn how to sell, and most people don't like the idea of that. Which also happens to be the second reason why Americans are becoming less satisfied with their hearing care professionals, which is the increased focus on hearing aid sales rather than hearing treatment. With many private practice audiology clinics being purchased by retail and venture capital groups, it is no surprise that the art of hearing treatment is being replaced by the art of hearing aid sales. I have heard over and over again from hundreds of my channel viewers about how their experience going into a hearing aid clinic is very similar to their experience when they go in to buy a used car, and I'm not saying that in a good way. Today, many hearing aid clinics are more focused on their hearing aid sales quotas than they are in achieving optimal treatment outcomes for their patients. I believe that the desire to sell more and more hearing aids, no matter what it takes, is starting to make hearing aid users feel like they're just a number rather than an actual human being who needs help with their hearing. Now, I'm not saying that hearing aid clinics shouldn't be able to turn a profit, but if the number one goal of a hearing care professional is to sell more hearing aids rather than focusing on optimal treatment outcomes, then it's no surprise why their patients are starting to hate them. You can often easily tell the motive of a hearing aid clinic based on the marketing that they put out. Full-page advertisements in your local newspaper announcing an amazing new technology, but you have to hurry because they're only accepting 10 new patients to use these new hearing aids. That is a clear red flag, and it's a sign that your hearing care professional is not a professional at all. They're just a hearing aid salesperson. Okay guys, hopefully you're learning something from this video so far. If you are, do me a huge favor, hit that like button. It really helps out the channel. And if you have not yet subscribed to the channel with notifications turned on, go ahead and do that as well, because that ensures that you never miss one of my newly released videos. And I release a bunch of new videos every single week. That being said, really appreciate it. Now back to the video. The third reason why Americans are becoming less satisfied with their hearing care professionals is the influence of insurance, particularly third-party administrators. Insurance is a double-edged sword. On one hand, it's really nice to have some coverage of your hearing aids and your hearing aid services. On the other hand, it is largely responsible for reducing your quality of care. Insurance has really started to affect, you guessed it, the amount of time that your hearing care professional can spend with you. Insurance companies and third-party administrators have been able to dictate the quality of care that your hearing care professional can provide, because they will only cover certain services and certain levels of technology. And on top of that, the ones that they do cover, they give your provider a significantly reduced rate for. So what is your hearing care professional supposed to do? Well, easy. They just eliminate certain services and reduce the amount of time that they spend with you, which in turn lowers your quality of care. This is particularly true if you have a Medicare Advantage plan that contracts with companies like True Hearing, Nations Hearing, and United Healthcare Hearing, to name a few. Each of these third-party administrators dictate the amount of reimbursement that your hearing care professional gets, and these reimbursement rates are rather low. So the only way the hearing care professional can continue to participate in these third-party arrangements is to reduce the amount of time that they spend with you so they don't lose money. Just like insurance is ruining the quality of healthcare in the United States by forcing your physician to see 15 patients inside of 1 hour, it's starting to ruin the hearing care profession as well. The fourth reason why Americans are becoming less satisfied with their hearing care professionals is the lack of best practice care. To be honest, providers not following best practices has been a problem for a long time. Best practices are considered the gold standard procedures that are required for you to maximize your success with hearing aids. Of course, best practices also take time because there are a lot of them that must be completed. For instance, performing real ear measurement to verify that your hearing aids have been programmed properly to your hearing loss prescription. Or validation outcome measures like the COSI, the IOIHA, or the AFAB that are used to ensure that you receive subjective perceived benefit with your hearing treatment. Or test box measures to ensure that your hearing aids are meeting manufacturer specifications before your hearing care professional dispenses them to you. All of which are often eliminated by hearing care professionals in order to save time, despite how important they are to your overall success with treatment. In fact, industry experts speculate that only 10 to 30% of hearing care professionals actually follow best practices, and I would suspect that these numbers are even a little bit high. No wonder individuals with hearing loss are becoming less satisfied with their hearing care professionals. However, if you would like an easy way to find a hearing care professional in your area who follows best practices, make sure that you go to my website, hearingup.com, to find a Hearing Up Network member near you. Hearing Up providers are committed to following comprehensive best practices to ensure that you hear your absolute best with your hearing aids, which will significantly increase your level of satisfaction with your hearing care provider. And the fifth reason why Americans are becoming less satisfied with their hearing care professionals is that their professionals are no longer providing person-centered care. Person-centered care, otherwise known as patient-centered care, is when your hearing care professional takes your wants, needs, and values into account when they're treating your hearing loss. In addition, just like the name would suggest, this is when they keep you at the center of all of the decisions that are made when it comes to your hearing treatment. Instead of providing person-centered care, a lot of hearing care professionals are providing the traditional medical model of care, which means that they test your hearing, and based on whatever results they get from your hearing test, that's what they base all of their recommendations on, and they typically only treat you with whatever devices they find to be more favorable. To truly understand which hearing aids are best for you and how to properly set up those devices, they have to get to know you as a person and know the areas that you struggle in that you want to improve. If your provider does not take the time to understand these things about you, then it is going to significantly reduce your level of satisfaction in your provider. If Americans are going to start becoming more satisfied with their hearing care professionals, it is going to require that they demand a higher quality of care, and it really starts with you. All right, there you go. Those are the 5 reasons why I believe Americans are becoming less satisfied with their hearing care professionals. If you want to be someone who loves your hearing care professional, then you are going to have to start demanding a higher quality quality of care. If you continue to let insurance dictate your quality of care, or if you go to a hearing care professional who does not follow best practices and doesn't do it in a person-centered care way, and they're only interested in selling you the next set of hearing aids and provide you with as little aftercare as humanly possible, then I'm sorry, but you're going to end up perpetuating the problem, and at the end of the day, you're going to end up hating your hearing care professional.